Hello everyone. Today's video is a Q&A video about methylene blue. I get lots of questions about methylene blue, and so I've kind of gotten to the habit of just compiling them all into a list and then just going to run through them rapid fire here. So I'm going to put a good dent in the ones that I've been accumulating over the last few weeks. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So lots of questions about different medications and their possible interactions with methylene blue. So I'm just gonna, they're interspersed here. So let's just get started. So the first one is, can the anti-seizure medication phenytoin be taken with methylene blue? So the general rule with methylene blue, to my understanding, is that we want to be really careful with medications that boost up serotonin. So if a medication is not known to boost up serotonin, then it's a pretty good initial litmus test that it's hopefully going to be okay with methylene blue. Now, I get really extra cautious when we're dealing with seizure medications because the stakes are very high if one interferes with the efficacy of that seizure medication. Now, some folks have very hard to control seizures, some have much easier to control seizures, so there's a bit of a spectrum, if you will, but I don't think I've had a patient to date with a seizure disorder that I have put on methylene blue, so I don't really have any clinical experience with that. So I'm not aware of any interactions between phenytoin and methylene blue, but if I was on phenytoin for controlling my seizures, I would definitely talk to my doctor before going on methylene blue to make sure that it was not going to potentially interact and to be monitored with that. The next one I can answer head on because it's a nice easy one. So it says, can MSM, also known as methylsulfonylmethane, be taken with methylene blue? So MSM being a quasi-common supplement that's out there, I use it a lot in my practice, and I've absolutely combined that with methylene blue and don't see any problematic interactions with that. So someone said, I put 3 drops of methylene blue in a glass of water, just took 2 big sips, and I became super tired and lightheaded. This took 2 days. This took 2 days. I felt very weird. I have long COVID and I'm not on any medications. Is this normal, and how to prevent this? And do I need to continue taking a few sips every day? And should I get used to this, or is this anemia? So few questions kind of wrapped into there. So hard to comment about the anemia piece. That's kind of unrelated to methylene blue. So that would be, of course, based on blood work and all of that, CBC, ferritin, iron panel, that kind of thing. So don't know how that might interact in this particular case. I've had a few videos that I posted just talking about side effects from methylene blue. Methylene blue can be very helpful, very therapeutic, but it also has some pretty strong intracellular, specifically has some pretty strong detoxification effects because it helps to upregulate our detoxification pathways by boosting up our antioxidant levels in the body overall, but also has some mitochondrial detoxification, so it's a pretty strong intracellular detoxifier, and so it can definitely cause folks to feel worse. So if I have a patient who starts methylene blue at a low dose, they start to feel unwell, then that tells me we need to pump the brakes on that methylene blue, either like really drop the dose down or maybe support their detox pathways or work on other things before we circle back to the methylene blue. Methylene blue is virtually never something that I start patients with. We almost always have other things in place before we add in the methylene blue because it can be really strong. Now, that being said, most of my patients are very unwell. They're dealing with complex chronic illnesses, and so I've treated a very biased population. If I was running like a biohacking specialty practice, I might start my patients with methylene blue on the first day if they were already feeling really well. So it really is all context dependent, like many things in life. Okay, so can cannabis users take small doses of liquid methylene blue? So I'm not aware of any interactions between cannabis and methylene blue. I have lots of patients who are taking CBD or they're using cannabis either medicinally or recreationally, also using methylene blue. Haven't seen any problems with those being taken together. Are there adverse reactions if taken with heart or blood thinner medications or blood sugar medications? Plenty of patients on methylene blue in my practice who are on any or all of those medications. I have not seen any issues with those drugs interacting either. Okay, just took some methylene blue for the first time the other day, once in the morning and once in the late afternoon, and I am still peeing blue. I took 30 drops of 3% USP, United States pharmacopoeia grade, both instances, and had 0 ill effects. I have Hashimoto's, but I'm not on any pharmaceuticals. And so it's just a little point of interest there. And then my 88-year-old mother took it 20 drops each instance, and a rock hard lymph node in her groin that has been there for at least 10 years simply vanished. Any idea about methylene blue doing that? We're all stunned. So yeah, that's awesome. Very, very cool. And as I was saying earlier, methylene blue seems to have these detoxification enhancing properties. So, and then the lymphatic system, if the liver, other detox systems in the body are backlogged, it seems to clinically at least lead to a backlog in the lymphatic system. So my best guess with a case like that would be that there is some type of a detox-mediated unblocking of the lymph, but like just by helping to reduce a back pressure on the lymph. But that's really cool, and I have not seen that in any of their patients before. There may be some other mechanism. I mean, at that dose, it's really not at an antimicrobial dose of methylene blue, to my understanding. That's still within the antioxidant dosing range, as I understand it. So I don't imagine it'd be like killing an infection or something like that, but don't know for sure. And I've heard some anecdotes from folks taking fairly low doses of methylene blue that it really helped with their, clearing up urinary tract infections and things like that. So probably more about methylene blue that we don't know than we do know, but very cool story. Thanks for sharing. All right, let's see. I've just been given some methylene blue. I'm also taking St. John's wort and have for years after weaning myself off of an SSRI. Sounds like I either avoid the methylene blue or stop taking the St. John's wort, or at least for a period of time. So, again, good to talk to your healthcare provider about specific advice for your individual personal scenario. Or oh my gosh, sorry, been talking all day, getting a little bit mush-mouthed here. I do have patients that are working with agents that boost up serotonin, and they're taking methylene blue. We have a long conversation about it. They make an informed decision, and I would say that in my experience, it's again case dependent. But with my patients, I wouldn't say it's an absolute contraindication, but we want to be extra careful and just working with very small amounts of methylene blue, building up gradually, and then making sure that the patient was very familiar with the symptoms of serotonin syndrome to watch out for. So yeah, I've had some patients where they're just doing really well on a medication or supplement that boosts up serotonin, but we want to tap into those benefits of methylene blue. Oftentimes we'll try other things first, but methylene blue is quite special, and so I have some patients who are working with that, but really important to work with your doctor about specifics for your case. Can I take methylene blue with hydrogen water? I recommend both to the same patients all the time, and I have not seen any interactions. Can't think of any reason on paper why it would not be okay to do both, except for the fact that hydrogen water is it has a very strong antioxidant enhancing effect in the body too. So we just want to be careful not to overdo it with all the antioxidant support all at once. I always generally phase things in one at a time, and but I've used them both together. I have no thyroid from thyroid cancer, so I'm dependent on Synthroid. Can I take methylene blue with Synthroid? I'm not aware of any interactions between Synthroid and methylene blue. Synthroid, of course, is synthetic T4, and we do have to be mindful about, say, taking Synthroid generally away from other medications and food and things like that to help optimize absorption. Just putting on our thinking caps, it's like, well, Synthroid is synthetic T4. We're making T4 already in our thyroid glands, so they should play nicely together, and no reason to suspect that they would interact. What about Suboxone? Is it safe to start methylene blue if you've been on Suboxone for a long time? I don't think I have any patients on Suboxone, to be honest, but looking at the kind of mechanisms of that being an opiate receptor agonist and opiate receptor antagonist, and methylene blue, not being an opiate-related thing. I don't think there'd be an interaction there, but definitely a good one to talk to your doctor about as well. Broken record here on this one. Okay, I made it through the list. So there's the rapid fire methylene blue Q&A. Any other questions about methylene blue, feel free to keep them coming. Just post in the comment section below. If you don't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that.